knowing that 76% of the spending goes toward mandatory spending, Social Security, Medicare, Medicaid, where are the offsets?
Well, here's the key to all of it. The president has made absolutely clear many times, as we have as well, that we're going to protect Medicare, Social Security, Medicaid for people who are legally beneficiaries of those programs. There are a lot of Americans who rely upon those programs, and we've got to ensure that they're safeguarded. That's a big priority of the White House and the Republicans in Congress. At the same time, we have to root out fraud, waste, and abuse. We have to eliminate people on, for example, on Medicaid who are not actually eligible to be there. Able-bodied workers, for example, young men who should never be on the program at all.
That was the Speaker of the House, Mike Johnson, on this program last month. Entitlements will be a major focus as the Senate looks at one big, beautiful bill that was passed in the House. Joining us now is Dr. Mehmet Oz, Administrator for the Centers for Medicare and Medicaid Services. It's great to have you on the program this morning. So as Speaker Johnson says there, and as the President has said time and time again, we are not doing any cutting of anything meaningful, he said, the President. The only thing we're cutting is waste, fraud, and abuse. So we're talking about those able-bodied men, for example, receiving benefits. We're talking about illegal immigrants that are on the system because Medicare has been expanded under the Obama administration and under the Biden administration. People are getting benefits, doctor, that they're not entitled to. That's what we're talking about here.
The fraud, waste, and abuse is in three different categories. The fraud, which, by the way, we find quite a bit of. There's about $14 billion we've identified with DOJ of folks who are duly enrolled wrongly in multiple states for Medicaid. So, yeah, you live in New Jersey, but you move to Pennsylvania, and which state gets your Medicaid? Turns out both states collect money from the federal government. A lot of times within a state, you'll have someone on Medicaid and the exchanges. So again, $14 billion just in that regard alone. But there's other areas as well which are abusive, and you just touched on one, which is the work requirement. Let's be clear what this means. It doesn't mean you have a job. It means you're trying to get a job, which is a good thing because we have twice as many jobs as there are people looking for them right now. But if you don't or can't seek a job, you can volunteer somewhere. You can get an education. You can help out with other people inside the household. There's many ways that you can chip in, and there is a work requirement for SNAP, right, the food stamps program. There's a lot we can do to I think there's a moral hazard if we don't, because you've got people who are not working, who could work, who should work, and it's better for them and better for the country if they do. And it's worth about $400 billion to the reconciliation bill that Speaker Johnson was speaking about. So if we do these things the right way, and there are a bunch of others I can offer to you as options, we're going to be able to clean up Medicaid so it actually serves the people for whom it was originally designed. Those at the dawn of their life, those are the children, those at the twilight of their life, the seniors, and those who are living in the shadows, folks who have disabilities who desperately need this program but aren't getting access to it in the way they should because other folks are clawing at the cloth of the system.
Yeah, and you recently wrote about it in an op-ed in the New York Times along with RFK Jr., Brooke Rollins, and Scott Turner. I encourage people to read that because it really explains what's happening here, that it should not be the way of American welfare, the way things are playing out right now. But the Democrat messaging is very powerful, Dr. Oz. They go out there and they say this is a war on the poor. 8.6 million people, they say, are going to lose their health insurance. At the same time, the New York Post reporting that really what's happening here is just a slow in spend. It's not cutting spend as drastically as the Democrats make it seem to be, from 4.6% per year to 3.7%. So your take on what their message is and how you need to counter that.
Well, the message for me is a very simple one. In every scenario I have seen, and I've seen, I think, most of them, we are increasing the amount of money we are spending on Medicaid because we do have to support Americans who are most vulnerable. Great societies are judged by how they take care of people who are vulnerable amongst them. That stated, we have to make the program sustainable. We have to protect it. That's what the Republicans are trying to do. President Trump has said over and over again, publicly and privately, he wants to love and cherish these programs because he wants to love and cherish the people in them. But to do that, you have to make sure, for example, they're not providers. If you don't pay providers, right, they do it for free, let's say, they can do that for 1 in 7 patients. But if you say, hey, listen, half your patients we're not going to pay you for, we're going to make programs that don't reimburse you, that doesn't work. Now providers begin to flee, and now we don't have enough, for example, mental health providers in rural parts of this country. There's much we can do as a country. It's a shared responsibility. We have to do it together. But the buck stops here. We've got to clean up the system. We're not paying $200 million for housekeeping anymore a year. We're not going to pay for illegal immigrants in states that are submitting those claims. Why should people living in Mississippi or Texas or Florida be paying for illegal immigrants getting health care in California?
Yeah.
As a nation, we need to be aligned to make this work.
Let me ask you about some of the estimates that are out there with respect to how much this is going to cost, because there actually are hurdles to implementation. And there's a little worry that some of the states are going to find ways to evade the intended costs or skirt the rules. What is the impact of that?
Well, states are incentivized right now not to cooperate with the federal government. Part of what was done with the expansion of Medicaid is a provision that the federal government pay 90% of the tab, as opposed to, for example, 50% of the tab in some other states or 60% of the tab. So the able-bodied individuals actually are getting more money for the state from the federal government. So right now, in many states, if you go to the hospital and you're an able-bodied person, the hospital gets paid more than if you're a Medicare beneficiary. Now, how does that work? People work their whole life, chipped into Medicare, they get the program, they retire thinking they've got a great system, and the hospital tells them, listen, you guys don't pay as well as the able-bodied folks on Medicaid who haven't been able to get a job. So in a way, we sort of value them more. And that's what ends up happening that disrupts the system. We need to align the federal government with what the states desire, what the president has to be aligned with the governors. Our president is a very deal-oriented man, as you know. He knows what the pressure points are. And if you don't have parties aligned, they're not going to collaborate.
All right, Dr. Mehmet Oz, thank you so much for being here this Sunday. We really appreciate your time.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.